Excellent. So experience is fundamental to everything that we do. And if you've ever been to a concert, the musicians will play so flawlessly and with such elegance that it looks easy, but it's not. It takes decades of experience and years of practice to make a beautiful piece of music. And the same thing is true for physicians. But unfortunately, physicians have no way to rehearse a surgery ahead of time. And because of that, unfortunately, sometimes errors can be made or surgeries could have been improved if physicians had had an opportunity to rehearse. So if we look back at how physicians prepare for surgery, it all started in the late 1800s with the invention of X-ray technology. And that was the first type of diagnostic imaging. For the first time, a physician could get an idea of what was happening inside their patient. Fast forward to the 1980s, an MRI and CT scan was invented. And this was vastly superior in that it allowed for a large number of slices of data to be gathered, each one passing through the patient's body. And by scrolling through these slices, you can get an idea of what's going on in 3 dimensions in the patient's body. Both of these diagnostic imaging techniques, though, are only visual. So while they allow doctors to see what was going on inside a patient in 2D slices, they weren't able to actually practice what they were going to do. That all changed last month when Lazarus 3D's PreSure technology was FDA cleared. PreSure stands for Preoperative Surgical Rehearsal, and it is the first technology that allows you to realistically rehearse an upcoming surgery. Here is an example of a simulated surgery on a Lazarus 3D model. And as you can see, our models recapitulate many of the features that are seen in actual patients. We can have many different tissue types, realistic bleeding, and we can recapitulate all of the important features that are required for a surgeon to rehearse a surgery. I'm going to show you another one. This is a thyroid model, and this is, again, not a real surgery. This is a simulated surgery on a copy of a patient built using Lazarus 3D's technology. This thyroid removal surgery is being performed at Cornell by the very experienced Dr. Jay Rosenberg and some of his other team members. So part of our design philosophy in this new type of medical device is that we need physicians to be able to use the same tools that they would use in a real surgery in the same way. Because that way, you're rehearsing a surgery and you're really preparing for what you're going to do on a patient. So here's how we build these models. We start by taking MRI or CT scan data of a patient. We then segment it and determine where each of the important structures are in that patient. So in this example, you can see a kidney with arteries, veins, tumor, and ureter. We then use that information to build a full 3-dimensional model of the patient. That is then fed into our proprietary in-house 3D printing process. And what's very important about Lazarus 3D's process is that we take care of all of these steps for you, so that all physicians have to worry about is getting the model that they want and be using it to rehearse and prepare for their patient's surgery. So this enables a new workflow. Ahead of a surgery, if you have a complicated case, or if a physician is still learning how to do a new type of operation, they can send Lazarus 3D their MRI or CT scan data of the patient. We analyze the data, produce the models. The physician can then rehearse on this PreSure model and operate with confidence in the real surgery. Our vision is to enable surgical perfection. So when simulation-based training was mandated in aviation, there was a 90% drop in the rate of fatal crashes within a decade. Early evidence around 3D printed rehearsal models indicate that you can remove as many as 5 out of 6 complications. So we hope that we can enable surgical perfection by allowing for the first time physicians to rehearse their surgeries ahead of time. We use a patented 3D printing process to build exact replicas of surgeries. Very importantly, this can be reimbursed by insurance. So there were medical billing codes issued covering Lazarus 3D's technology in the 2020 release, and some of our hospital partners have already received reimbursement for Lazarus 3D models. Our initial clearance is for genitourinary conditions. That includes conditions like kidney cancer, prostate cancer, and congenital malformations of the genitals. So here's what a few doctors are saying about PreSure. Dr. Richard Link said that the Lazarus 3D model was the best model for partial nephrectomy that he had ever seen. Dr. Tomaszewski at MD Anderson Cancer Center said it felt like operating on the patient itself, and that this technology should be used prior to all kidney-sparing surgeries in patients with complex tumor anatomy. There have been multiple clinical validations of PreSure and multiple scientific publications supporting our work, with many more on the way. Here's an example of a use case. This patient had a large osteocarcinoma on the neck and was referred to MD Anderson Cancer Center due to the difficulty of this operation. On the left, you can see Lazarus 3D's digital twin or digital model of the patient that was used by the surgeon team in order to prepare for the surgery. And on the right, you can see this is an actual live shot during a surgery at MD Anderson Cancer Center, where the surgeons are referring to Lazarus 3D's model to help prepare their next step in this case. Here's another example from Boston Medical Center. The extremely experienced Dr. Sean Wasson was working with a patient named Laura, and she had a complex kidney tumor, and she had a complex kidney tumor, and English was not her first language. So Dr. Wasson used the Lazarus 3D model in order to help communicate with the patient. She said, "I was scared, but Dr. Wasson made us feel very comfortable. I felt confident that he took the time to explain the procedure, and he was always looking out for me." Here's another example of a use case. This is again from MD Anderson Cancer Center, where a Lazarus 3D model was used to prepare implants and prepare reconstruction following a osteocarcinoma. Very importantly, this technology is now covered by billing codes. So there are CPT codes, and this is just the first page of Lazarus 3D's reimbursement guide. So if you're a physician looking to use this technology, then please reach out to us. Lazarus 3D has received awards and recognitions, including from the FDA, Blue Cross Blue Shield, and most recently, Kevin O'Leary. We plan to have this product on the market for every major surgical indication by 2023. So really what we're talking about is changing the future of surgical care. We are looking to enable surgical perfection by allowing your physician to rehearse on a copy of you. These models can also be used to enhance patient education. And with that, I'd like to thank all of you for your time, and I will be answering any questions in the chat.